Hey, it's Dr. Presley here, and I wanted to talk about getting you and your home ready prior to total joint arthroplasty. So some things to think about are things like assistive devices. You know, after the joint reconstruction, you're gonna be in some pain when you walk. So you wanna think about getting a cane and a walker prior to surgery. You know, usually you'll be on the walker for a little while, and then working with physical therapy, they'll transition you to a cane and then transition you to nothing, independent walking. Some other things to think about is getting your home ready. You wanna remove any tripping hazards like any loose rugs, any shoes, anything like that that you might trip on and harm yourself. Some other things to think about, you know, a shower chair if you want to make showering a little safer for you, or even a raised toilet seat. People sometimes like that, especially with hip replacements, so they don't have to go down as far. Those are some things to think about. You know, we have a DME department that dispenses these things prior to patient surgeries, and a lot of times insurance companies will cover the assistive devices like the walker and the cane, or sometimes they'll cover a portion of it, and it's usually not very expensive to cover the rest. But other things that you can think about are ice machines, which is nice. You put this pad on your knee and the water circulates through the ice machine to keep nice cold water flowing through this pad. That helps with inflammation and swelling, and patients love these. However, they're typically not covered by insurance companies. So talk to your doctor, see if they have a DME department that can help you obtain some of these devices. Now, those are some things to look into prior to your surgery and your total joint replacement to get you ready, and we'll talk more about it later.